let's go on technique a little bit. Are you putting the catheter, whether it's large or normal, 7, 8 French, are you taking it to the face of the clot and then just aspirating and then sitting there? Are you pushing while it's aspirating? We have a lot of different techniques we use in neuro.
Right.
And what is your technique? And then I want to know some adjunctive techniques too.
Yeah, so absolutely. So, the adapt technique that you were describing, was largely, adapted for the extract technique,
Nice.
the prism, into the, from the prism registry and whatnot too.
Yeah.
So, Jim Beninati talks about this quite a bit too, so she's what they developed, the idea that you come onto the face of the thrombus, sit on it for 90 seconds, and then allow that clot to digest into the catheter. And doing so allows you to really get good purchase, especially with a large bore system. I mean, the thing about it is that, with the larger systems, especially with more mobile thrombus, it obliterates the clot. So it's not like, I mean, most of the stuff that you would, spend a lot of time taking several passes at with a smaller system, with something like a 12 French system, you're going to just obliterate that thrombus. And the only stuff that you're going to have to spend a little time on is the stuff that's so organized that it's not going to really come through any of the other systems. So that type of thrombus, I have another example I can think of was a patient who presented with blast crisis and essentially embolized all of this, cancer material down his legs. It was the clot that was formed, which was, when we sent it off to path, it was all blast, was indistinguishable from tendon or bone. I mean, it was that hard.
Wow.
So you can't suck that out with even the 8 French system. And, it plugged up the Cat 12 and even the dry seal sheet. I mean, the dry seal was
corked it in there.
Corked in the dry seal, and I had to aspirate out the dry seal on the way out. That type of stuff, when you look at it, it looked like I'd done an endarterectomy.
You're like, so is this artery? Or
well, right, exactly. I've had people look at this and ask, what was this? And, so, that type of stuff, I mean, I think the extract technique is really good for corking out discrete type thrombus. Now, if you have overwhelming clot, that's when we use, separators and whatnot too.
I was going to ask about that.
Do you use a separator? Yeah.
Do you use
I used to not use it because I believed in the extract exclusively for many years.
Yeah.
And then I discovered that I was like, why am I spending all this time struggling? Especially when you use a smaller system. I think the separator is really key to break this thrombus down into smaller, more manageable chunks without corking or clogging up the system. So the corking technique is good, but the problem is you have to go in and out multiple times, and sometimes that gets to be cumbersome.
Yeah.
So utilizing the separator, especially when you have more organized clot, is a good idea. Now there are other devices out there too. People have utilized, a lot of the stent retriever type technology in conjunction with these types of catheters with variable degrees of success. The problem with some of those devices is that they're so soft, and they're designed to be used in the brain. Largely, they end up collapsing down or not really doing as much, I think, in the lower extremities. But people have done endofogarty. They've taken a balloon and essentially inflated that to low atmospheres and just kind of pulled back into the aspiration catheter. That's a very valid technique as well, too, and can be done through the lumen of the 12 French catheter, even the smaller ones as well, too. So I think those types of adjunctive tools and techniques can be useful.
Using a filter? Ever used a filter?
Yeah, I've used a filter several times, in fact. And I think there are a number of devices coming down the pipe that will utilize a filter-like stent retriever technology with aspiration. The only drawback with using a filter I've encountered, I had this in a couple upper extremity cases too, was that sometimes you overwhelm the filter and the filter spills over and then you end up sending stuff downstream. So that's where I think coupling it with aspiration is really key to make sure that whatever you have in that basket doesn't spread out, but you do risk squeegeeing that clot out of the basket and going downstream, and then you're going to chase after that clot.
Yeah.